This is Coach PDHPE with another Core 1 video. For more Year 12 PDHPE information, you can go to coachpdhpe.com or Twitter at coachpdhpe.com. We're up to Core 1, Key Idea 2, what are the priority issues for improving Australia's health? We're at the dot point groups experiencing health inequities. On a previous video, I had a look at the inequities suffered by Aboriginal and Torres Strait Islander people, and today I'm focusing on people living in rural and remote areas. There are 3 questions on the right-hand side of the syllabus to look at. I've slightly rewritten them to hopefully make them a little bit more easier to understand. Those 3 questions are: what are the inequities that people living in rural and remote areas suffer? How do the determinants of health contribute towards the inequities? And finally, what is the role of individuals, communities and governments in helping to overcome these inequities? So the first dash point is, what is the nature and extent of the health inequities for people living in rural and remote areas? Australians living in regional and remote areas, in some instances, have a mortality rate of up to 70% higher than their major city counterparts. Now that's obviously in the very remotest areas of Australia, but generally speaking, even in some of the rural areas, they have a mortality rate of somewhere between 10 to 20% higher than the rest of the population. On average, people living in the more inaccessible regions of Australia are disadvantaged with regard to employment opportunities, access to goods and services, and then even in some cases, basic necessities such as clean water and food. So let's have a closer look at some of the stats. The proportion of people living in remote areas in particular who drink alcohol at dangerous levels is very high compared to the people living in the major cities. This can lead to a range of long-term health issues such as kidney failure and also cardiovascular disease. People living in rural and remote areas are 2.5 times at higher risk of dying due to smoking-related causes, and that's going to have a big focus on lung cancer. Their access to primary care, such as dental care and specialist services, is also becoming more difficult as many hospitals get scaled back in regional areas of the country. It requires for people living in rural areas in particular and remote areas to have greater travel time and expense, and also accommodation expenses when they're required to go to hospital. This makes it difficult for them to make appointments, and in some cases they simply forego the appointments because it all becomes just too difficult. The state of the Indigenous health is a national disgrace, as looked at in the previous video, and around 70% of the nation's Indigenous population live outside the major cities. So this helps to inflate these figures of poor rural and remote health. Medicare expenditure on mental health services in the regions and rural areas of Australia is a long way behind what's spent on people living in the city. You can see the comparison there. It's $42 per head for people living in major cities and only $9 per head for people living in rural and remote areas. So what causes these inequities? This is the second dash point, and that is the socio-cultural, environmental and economic determinants. The World Health Organization defines the social determinants of health as the conditions in which people are born, grow up in, live and work. Rural and remote people suffer with poorer access to communications such as high-speed broadband and poor mobile phone coverage. Also, environmental challenges such as drought, floods and bushfires can also lead to mental illness. So a closer look at the determinants, and we'll have a look at some of the socio-cultural determinants. Now, to be honest, this is difficult to write about, I think, when it comes to rural and remote areas, and I think about the best you can come up with is that there does appear to be a culture of heavy drinking in rural and remote areas, which, as I said previously, can lead to some long-term diseases such as kidney failure and higher risk of cardiovascular disease. Socioeconomic determinants. Socioeconomically disadvantaged people often cannot afford to make healthy lifestyle choices due to reduced financial capacity. People living in rural and remote areas have lower socioeconomic status than their city counterparts. The capacity to access goods and services required for a healthy lifestyle, including adequate nutritious food, housing, transport and healthcare, is largely depending on having above average income. Environmental determinants. Water supply is poor, particularly in remote areas of the country. There's a lack of adequate infrastructure in remote areas, including transport, which makes it difficult to get to medical appointments. Also, areas that we take for granted in the city, such as access to telephone and internet, is also very poor in remote areas of the country. Finally, the last dash point, the role of individuals, communities and governments. We've had a look at firstly how big the problem is, we then looked at some of the reasons for the problem, and finally what can be done about the problem. Firstly, we have a look at role of what individuals can do. Education is the biggest factor in an individual's ability to have control over their own health. Individuals have the ability to take control over their education, although it's difficult on occasions, but if they take greater control over their education, it can lead to better health outcomes. This is because better educated people have lower morbidity rates for the most common acute and chronic diseases such as cardiovascular disease and cancer. Greater resources associated with higher levels of education and a learned appreciation for the importance of good health behaviours comes with having a higher level of income through education. So the role of communities. Travelling to a city hospital is a barrier for all patients who live in more remote areas. If equitable access to specialist services for rural Indigenous patients is to be achieved, improved health-related transport is needed, with better coordination of appointments and flexibility to accommodate late arrivals in city hospitals. Finally, the role of government. They have three initiatives running to help people living in rural areas. Firstly, there's the National Rural and Remote Health Infrastructure Program. This provides additional funding to people living in rural and remote communities for essential health infrastructure and equipment. There's the Royal Flying Doctor Service, and also finally the Rural Women's GP Service. This service travels the country to remote areas, and it's made up of female general practitioners, and they travel to communities in all states in the Northern Territory to conduct general practice clinics. This enables women to consult a female GP about a range of issues. So in conclusion, this dash point is actually very closely linked to the ATSI people. It's a complex issue because of the sheer distance involved, which means providing access to health services being very challenging.